ABC News Chief Medical Correspondent Dr. Jennifer Ashton is here with us. Dr. Jen, let's get right to that expected CDC announcement backtracking on mask guidelines. What is your take and what could it mean for us going forward?
Well, I think there are really two main points to consider when we hear about what the CDC is expecting to say later today. Number one, critically important in medicine, science, public health, to always stay flexible, to be able to incorporate new and evolving information and use that information to protect people's health, whether it's an individual patient or an entire country. So I think that it's not a flip-flop, really. It's a demonstration of that flexibility and the ability to hit the brake as well as the gas as we proceed through this pandemic. The other side of it, however, which is a little more subtle and a little more confusing, is that if people are vaccinated, the recommendation that they put masks on, I would like to hear from the CDC, is that to protect the person wearing the mask or is that to protect others? Because the fact of the matter is these breakthrough cases, largely driven by the Delta variant, are rare in people who are vaccinated. They will happen, they are happening, but there's also data that if a person who's been fully vaccinated is infected, they are very, very unlikely to transmit that virus to someone else. So I would really like to hear why that recommendation is coming. Again, it's always an individual's personal choice if they feel more comfortable wearing a mask, even if they have been vaccinated. But some dots need to be connected here, and hopefully we'll hear more about that later today.
All right, Dr. Jen, you read my mind on the next question about those breakthrough cases and how rare they are. Do you think, though, with your question in particular about the messaging there, you think that will contribute to vaccine hesitancy as officials are trying to get more people vaccinated?
Well, I think that people who have not yet been vaccinated really need an opportunity to have their concerns and questions heard and discussed and understood by a healthcare professional. And sometimes, unfortunately, that opportunity doesn't happen. I know I've been dealing with that in my own practice with my own patients, and that's a conversation that could take 20 to 30 minutes of direct patient counseling. Usually at the end of that time, when people compare risk to risk, head to head, apples to apples, they go ahead and understand that the real risk is not getting vaccinated. So I think when people hear these new guidelines, they might say, wow, a lot of our freedoms, our behaviors might be curtailed again if more of us aren't vaccinated. But at the end of the day, because I deal with individuals, not massive numbers of people, not stacks of paper, I think people who haven't been vaccinated need to hear what it means to them more than our entire society. I think that's the really important part.
All right, we'll see what the CDC says this afternoon. Dr. Jen, ABC News Chief Medical Correspondent, we appreciate your time.
Thanks so much for having me.